in years and would have loved to have had another baby. But, she had kind of hung that up and like, this is it. Now I want to work on weight loss. So we did tirzepatide. And then guess what? Like 3 months in, and she is now pregnant.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Kayla Sanders, a family nurse practitioner who began her career in 2015 and soon after found her passion in aesthetics and wellness. With years of advanced training in hormone replacement and optimization, she helps women connect the dots between their health, energy, and daily lives, whether they're raising kids, running businesses, or just trying to feel like the best version of themselves. Kayla is also the founder of Beauty Boss Co. Aesthetics and Wellness and Beauty Boss Academy, which not only cares for patients, but also trains and mentors other healthcare professionals entering the aesthetic space. She's passionate about evolving with the industry, empowering others, and reminding women that it's possible to look good, feel good, and thrive in every season of life. So Kayla, welcome and glad to have you here.
Good morning. Thanks so much for having me.
Yes, let's dive right into it, Kayla. How did you first get interested in medicine, the field of medicine?
So I come from a long family of nurses. I have on my dad's side of the family, he has several aunts, a big family that were all in nursing. So kind of got that introduction from that way, but also always just have been interested in helping people and actively trying to find what my calling is and actually making a difference in people's lives. And I found that in nursing.
Got it.
So that's where I actually got started as an RN and worked mostly in community health and being kind of out in the community, and later went to nurse practitioner school to be a primary care nurse practitioner in family practice.
Okay. And so then how did you make that transition over to aesthetics then?
Interesting start. So that was back, aesthetics has changed so much over the last few years.
Mhm.
I started in about 2016, started practicing in family practice in about 2015 for a privately owned family practice clinic. And the couple that owned that clinic actually opened an aesthetics practice as well. So it was next door. There's actually just like a hallway connecting the family practice side where we were doing primary care and sick visits, and the laser or aesthetic clinic on the other side. And we would kind of pop back and forth, interested in design. um, at that point, they had some changes in their practice ownership, and I went to work in primary care for another practice and had some aesthetics clients that, of course, in aesthetics, when you find your person that you're comfortable with, you want to hang with them. So they were kind of in contact with me like, are you going to be doing this? We want to keep seeing you. And so I then started injecting as a sole proprietor, kind of on my own, subleasing a small space inside of a salon. And we just kind of grew from there.
Oh, wow. Okay. So now that you have this practice and it's grown, what are some of the treatments that most of your patients, most of your clients are coming to you for?
We have a little bit of a unique setup, and we really try to take an integrative approach or holistic approach, because we know that when people aren't their healthiest, then their aesthetics results also don't come out as well. So I do a lot of hormone optimization. We do some weight loss therapy. We have a whole wellness side where we practice some functional medicine, and then also the aesthetic side. And of course, those most common treatments are going to be your neuromodulator injections. Aesthetics is moving wholly toward a lot of regenerative medicine and regenerative aesthetics. So
Mhm.
we do a lot of those things too. All of our providers, your biostimulators, your PRF, your PDGF, those types of regenerative treatments are becoming a big part of what we do on the aesthetic side, but our wellness side really kind of all integrates everything together, giving people their best results overall. So we
Mm.
try to integrate that as much as we can, and taking care of the whole person, not just, I'm going to give you your Botox today and let you go out the door, and I'll see you in 3, 4 months.
Yeah. Okay, now since you have advanced training in the hormone replacement, hormone optimization side, and you mentioned that also, I want to dive a little bit deeper into that. So, what is hormone optimization and why is it important for people?
Yeah, so I found very, very quickly when I started practicing as a nurse practitioner in family practice that there is a giant gap in effectively treating, particularly women's hormones. Okay, so in primary care, I can tell you as a nurse practitioner in nurse practitioner school, getting family practice certified, I think we maybe spent 5 minutes on hormones in school. And even in my women's health practicum studies, very, very, very little time spent on hormones. My women's health was focused on other areas, and that was just what my preceptor was doing at the time. So I had very, very little exposure. When you are practicing in traditional medicine, you're trained to look for the red on the labs when they print out for you and what's low and what's high, what's normal, what's abnormal. And if nothing is in the red, then you're good. And that's just simply not true, particularly when it comes to women's hormones. So I found that out very, very quickly and was really interested in bridging that gap for my patients. And so as my practice grew and kind of went out on my own and opened Beauty Boss Company, our actual first location, that's a big area that I really wanted to hone in on. So I took it upon myself to really dive in to investing in that education and learning what the difference in normal and optimal is and how important that is in women's health, not only in their wellness, but also aesthetics as well. So there's a big difference there. We're not just looking at what's normal and what flags as a red, low, or high on the lab. It's is that optimal for you at your age, where you stand in your life right now, and your needs, and what is important to you and the goals that you're trying to achieve in your life. So that can be different for every single woman that I see every day.
Mm, okay. And so when it comes to this hormone treatment, particularly for women, is it really just about getting more estrogen? Because I've heard that it's also not just that when it comes to hormone therapy. There's, yeah, estrogen's part of it,
Yeah.
but then there's the progesterone, there's also testosterone, which I think maybe
Mhm.
a lot of women or people don't realize that women sometimes do need
Right.
testosterone. Can you talk a little bit more about that part of it?
Yeah, for sure. I think as a whole in medicine, when you think men's hormones, we think about testosterone. And when we think about women, we think about estrogen. When really there's a huge misconception there because we actually produce ovaries actually produce more testosterone than they do estrogen. So it's actually a really important hormone for us. It's just we get this much of it where men get a really large amount of it. That doesn't mean that it's less important to the balancing of our health and wellness and optimization of our hormones. So it's a balancing act, and that can look different for everyone as far as different forms of hormones that we take, how we supplement that. The estrogen is important, the progesterone is important, the testosterone is important, optimization of the thyroid is important. Insulin is a hormone. So we look at that. We look at if people are insulin resistant, if they're able to manage that part of their body well and on their own, or if they need help in that area too. It's really a giant puzzle, and you have to make all the pieces fit perfectly rather than, okay, so you're postmenopausal, here's your 1 milligram of estradiol tablet. We'll see you next year for your annual exam. So that is definitely not the way that that should be managed. And I think we're getting more and more practitioners on board with realizing that and kind of going to bat for us to actually get some true indications for treatment for women and hormones like we have for men.
Okay. And in what situations would somebody be looking for hormone therapy? Like, is there certain like criteria? Are there certain symptoms, or is it just that, hey, I've heard that hormone therapy can be really good for me and it can make me feel better, and just overall, like, if this is my base level, I want to be up here. Can that
Yeah,
also be used for that? Or I guess overall, what situations would someone be looking at hormone therapy?
it's all the above. So I see women that come in from my skin just doesn't look good. And no matter what kind of treatments I get, I'm not getting to where I want to be. From there to them not even recognizing that there's a missing link of not being as healthy as they could be that really could impact their skin and the way that they look aesthetically to I feel pretty good and I've been doing this for a while, but I really want to push it to the limit and I want to get my health as optimized as possible. So we see all of those things. I will tell you that, we are a med spa. My business and brand was really built on the aesthetic side and integrated wellness in just because I saw that kind of gap in care and missing piece. But I can tell you that these women that come and sit in my chair and we talk about what their goals are, and I'm like, have you had your labs drawn? Like, do we know that you physically have all the pieces you need to have? And is everything performing at the level it needs to be for you to get that best outcome to look how you want to look? Because it does play a big role. And from that point, if we can add that piece in, I will tell you that I see them again in 3 months, 2 to 3 months, and they will look like a completely different person just with the addition of hormone optimization. The way that their skin looks, they feel better, so they look better. They exude that confidence even without heavy aesthetic treatments, just because we have everything aligned physically and optimized to allow them to get to that level and get to that result.
Okay. So now when it comes to the hormone therapy, I've kind of heard that it's typically going to be more important, especially for women when they start getting into the 30s, the 40s, and even all that, like the perimenopause phase and the menopause phase and all that. So is that really the reality of it, or can it also be for women that are even younger that aren't in that perimenopause phase?
It can definitely be for younger women as well. There is no strict timeline on which perimenopause starts. That can be due to lots of extrinsic factors like you've been through a lot of trauma, you've had a lot of health problems. Your hormones can start to decline a lot earlier because of those things, medications that you've had to be on. We see women that have PCOS that can really turn your life upside down, and that can be in younger life. So we've had, people that come in struggling with fertility just simply because they have PCOS and they have yet to find someone that will actively manage that for them. And even sometimes just simple supplementations to help get that insulin resistance in check and to get everything normalized again can make a huge difference for them from that standpoint. Perimenopausal time frame can be up to like 10 years before you actually start to go through menopause. So that's a pretty big gap. So we're missing a lot of women that are going to their primary offices saying, I'm anxious, I'm depressed, I can't sleep. I just don't feel good. I don't feel like myself. They've truly lost themselves, and they're being told that it's too early to look at any of those things. When in reality, it's not. It's totally not out of the question for those things to be happening in our 30s. So I think it can be any of the above. And also, even older. You look at the old guidelines that have now been squashed that we know aren't really what we should be following, where we just said, oh, you're older, you've been going through this too long, so you need to just wait it out at this point. It's just the way life is. We know that's also not correct. And our women that are a little bit older and have been overlooked and told to just deal with these symptoms, that we can help them too. We
Mm.
have guidelines to abide by and protocols in place to safely treat them too and optimize their health as well.
Okay. And you mentioned fertility. So can hormone treatment also help with fertility if someone's trying to get pregnant, start a family? Can this help with fertility?
For sure. So I think it's all about regulating when you're talking about fertility. People that have PCOS, for example, is going to be the large group that we see that issue in when they're younger and they are trying to have children. I have personally been able to just look at a patient. You can tell they don't feel their best. You dive into a stronger, deeper conversation with them. What's really going on? Well, everything's crazy. My cycles aren't either not happening at all or they're irregular. You ask, have you seen anybody about this? And the answer is yes, but nothing was done. They haven't even been handed a diagnosis of PCOS yet. So I think simple things, regulating insulin, helping with insulin resistance, regulating insulin sensitivity, even things that small, not even really messing with your estrogen, progesterone, testosterone hormones can really make a difference in regulating that for people. And I have seen that happen even recently. A patient that was on the GLP-1s, that's like a hot topic right now, right? Tirzepatide, semaglutide. It's not on label to use them for other things besides weight loss. And I don't know what we can even like talk about out loud, like legally as far as how those are being used. But, I had a client that was utilizing it for weight loss that hadn't been able to have any regularity in their hormonal cycles in years and would have loved to have had another baby. But, she had kind of hung that up and like, this is it. Now I want to work on weight loss. So we did tirzepatide. And then guess what? Like 3 months in, and she is now pregnant. So something that simple. For someone that has a diagnosis of PCOS, regulating that insulin level, getting rid of that insulin sensitivity or insulin resistance, upregulating that insulin sensitivity, and that's all that it took. It was that simple.
Wow. Wow. So when it comes to the hormone therapy side, is there really any downside to just getting checked, getting your labs done to see if it can help you? Or is it really just going to be for certain situations that people should get checked to see if it can help?
There's absolutely not a downside because you never know what you may find and catch early that could make a difference in saving you the negative effects of allowing those hormone levels to fall too low before you ever get it caught. So you can't ever check too early. Plus, it's never a bad thing to just have a really good baseline to go by as the years go by.
Okay. Now, what are some of the most common misconceptions or myths that you hear from your clients and your patients when it comes to hormone therapy? I'm sure that there's a lot of people out there that have some ideas of what they think it is or just have completely wrong ideas about what it is. So what are some of the most
Yeah.
common misconceptions you hear?
Um, A couple of the most common, I would say, one is what testosterone is going to do to me if I take testosterone as a female, that it's going to make me grow a beard, that I'm never going to get rid of. It's going to make me look like a man. And, that's not our goal. I think that there are certainly forms of testosterone replacement for women that are much higher risk to give you those types of symptoms that are certainly not the recommended forms of hormone replacement therapy at this time. But if you are being monitored by someone that truly has experience in hormone replacement therapy and they are controlling your levels the way that they should be, that should not happen to you. If so, then we need to do something about that and either back off on dose or check some other markers and see if there's something going on and making you more susceptible to those types of side effects. The other thing is I'm too old for hormone replacement therapy. I have been postmenopausal for however many years. And that does not mean that there is not something that's completely safe and effective for you to do at that time period in your life. It could be totally worth it to give you better quality of life and even longevity.
Wow. Okay. So do people need to think really about the quality of the hormones if they're going to get this treatment from a provider? Is there really a difference between the quality of hormones, or is it just kind of everyone kind of has the same hormones and it's just a matter of finding out is this good for you or not, and what dose do you need?
I think that there's definitely some forms of hormone replacement therapy that are better than others, that are more effective, that are safer, that more closely mimic our natural hormone cycles than others. In our practice, I'm not a hormone pellet fan. I
Mm,
know people love them.
yeah.
I'm not afraid to say it. I tell my patients every single day, like that's just not something we do here. I worked for a larger hormone replacement therapy company for a little while that's what we did in clinic all day, every day, men and women's hormones. And our medical director, I joked that maybe I was just brainwashed from the beginning to like hate pellets.
Um,
I don't know, but he really, really didn't. And he had, lots of good reasons for that not being his first choice. That's just how I learned. That's how I was brought up on hormone replacement therapy. And I went into my own practice with a little bit more of an open mind. Like, okay, maybe, I don't know, maybe he didn't like the pellet rep. I don't know. Like, why? Maybe that was his reasoning.
mm,
And I definitely did see a lot of those things reflected clinically with women that were coming to me unhappy with the results they were getting with pellets after a year and a half in. And it should be able to be consistent. You should be able to get really good results consistently. And if you're being followed appropriately, it should wax and wane with your natural hormones as you age and as your needs change. And that's just not the way that pellet therapy really works.
Mm.
I have women coming to me with a testosterone 6 times as high as it should be
Wow.
when they've been on pellets,
Mhm.
significantly higher even after I've had them wait to do their blood work 3 and 4 months into their insertion. So I think that there are definitely options for types of replacement that are just going to be safer, more effective over a long period of time than others.
Okay.
So,
And for people that don't know, and also for myself, my understanding with pellets is that basically you put the pellet under someone's skin, and then over time it will just slowly start to dissipate into the body. So you mentioned some of the case studies that, or the case studies that you've seen where there's been issues with it. I mean, what do you think that it's not necessarily? Well, I guess why don't you like that? What do you think is like kind of the shortcoming of that type of treatment method?
inconsistency, inconsistency of absorption.
Mhm.
There's no way for you to regulate that once it's
Mhm.
in, and it's going to do what it's going to do. There's no way to adjust it from that point moving forward. You're
Mhm.
putting a large enough dose in under the skin, expecting it to absorb to last someone 3, 4 months. So they're getting a giant spike in hormone that then invariably and irregularly goes down over that 3 to 4 month period. Um, just the inconsistency is the main issue. We were at a conference this past summer, and one of the portions of the conference that I chose to attend was on hormone optimization, wellness, like what are we going to see in the upcoming year? And it was a panel. And so there were like 3, 4 physicians on the stage taking questions. And one of the questions was, what trend do you hope to see go away by the year 2026?
Mhm.
And every single physician on the panel said hormone pellets.
Hmm.
So I think it's interesting that the people that we look to in the hormone optimization wellness industry that truly do have that experience, that they truly are specialists in that area, don't use them. And
Mm.
so, you have to look at what is the reason that it's gotten so popular. And is it for ROI for your provider? Is
Mm.
that what it is?
Mm.
Maybe because it's a quick, easy way to, swipe a card, I'll see you in 3 months, rather than really spending the time to dive in to those labs and make the medication adjustments. If I have a patient that texts me at week 4 after initiating hormone replacement therapy and they're like, I'm just not feeling good. I'm like, hey, hang with me. We want a good 6 weeks, but if we really need to look right now, we can. And
Mhm.
we do, and something's just majorly off, or we're not meeting what we need to be meeting at that point in time. I can adjust that day for them rather than it's in, you got to hang out for 3, 4 months. We'll see what happens. Next time I see you, let me know how you felt. It's just not very personalized and it's definitely not consistent. And I think we definitely have better options.
Okay. Now, as a follow-up to that, if someone is looking for some type of, or looking for a provider who can help them with their hormone therapy, what would be the most important piece of advice you can give to them as they're doing their search, as they're trying to find someone who they feel comfortable with, who is knowledgeable, and who can really help them with this type of treatment?
That's difficult. A lot of our credentialing, of course, is public. Obviously, you want to look and make sure that you're seeing somebody that truly is credentialed. But I don't know that there's proof, like online anywhere, that I've had extensive training and experience in hormone replacement therapy.
Mhm.
I think that that would be difficult. And so, what I always tell people, because we don't take insurance in our practice, we are cash pay only. So, if you have a really good insurance, it may be cheaper for you to see someone like, say, in an OBGYN clinic that does specialize in hormones that can take your insurance, maybe. So I do have that conversation with people sometimes after I consult with them, and they're like, well, it's a little more than I want to spend out of pocket for labs and that sort of thing. My advice to them is usually just have a conversation. You don't have to continue care there if you don't want to. And if they don't sound like they know what they're talking about and you don't feel like they truly care about you and about your outcome, and all they're wanting to do is take the quickest route to get your hormones inserted and get you out the door, then that may not be the place for you and you should continue to look around.
Okay, great advice. Now, Kayla, I'm curious, what role do you believe creativity plays in how you approach your patient care? Because I think when people think about medicine, creativity is probably not the first word that comes to mind.
Right.
But in your practice, how do you think creativity plays a role, if it does at all?
It definitely does in aesthetics. Aesthetics is medicine. And I think that sometimes we forget that aesthetics still is a medical specialty. It's not a hobby. It's not just fun, but what makes it different and more challenging, really, you can teach anyone medicine, right? So you can memorize the medications and what their actions are and how they work in the body, and you can utilize that information to treat something when it's in black and white, when you're treating, illnesses or whatever. You can't teach artistry to everyone.
Mhm.
Not everyone has that eye and the creative eye, like you mentioned, you said creativity. No, not every person has that artistic touch. So, no two faces are exactly the same. We know about what everyone's anatomy is supposed to look like, but every face looks so different. So, you do have to have sometimes that element of artistry to create symmetry, to help your patient to achieve the goals that they're telling you that they want to achieve when the treatment that maybe they've signed up for isn't what you know that they need to get there. And so sometimes that takes a level of creativity, even in your consultation, to get them to see the big picture and the end result that you are seeing.
Okay. Now, Kayla, I'm curious, where do you think the future of SX is going?
100% regenerative medicine, 100% regenerative aesthetics. I think we've seen a huge push. I had a meeting with one of our brand reps this last week, and so she was showing me percentages of growth across their brands, like between filler and the neuromodulators and the biostimulatory injections. And it was so interesting to see that even in our practice, the amount of Sculptra is the brand name. I don't know if I'm allowed to say brands, but Sculptra, as far as a biostimulatory injectable agent, was up like 25% this year, just for us in our practice. And
Yeah.
so I think that that's reflected across the nation in practices for sure. We've done a whole lot more regenerative therapy with PRF. We've brought PDGF on board and been doing a ton of that as far as regenerative treatments for the face. And filler is definitely on the downward side for sure. So I think that that's reflected in, what we've just kind of purchased here in the clinic and what we've been utilizing on our patients, and also the things that they're asking for. I want to look natural. I want to look just how like I look, except refreshed. I don't want anybody to be able to put a finger on what I've had done, just that you look really, really good and youthful today. Right? So that's kind of what we're hearing a whole lot more of. So I would definitely say regenerative aesthetics.
Okay. And what do you think is fueling that? Do you think it is kind of that push of people to that want to look natural and refreshed, or do you think there's more behind it than that?
I don't know. I hear a little bit of everything. I think that there's a whole lot of buzz around, dissolving a filler now, where the goal used to be to put all this filler in to get you the lift and contour and all of that. We've seen, I think it started with celebrities, that everyone wants to kind of mimic someone's look.
Mhm.
And so we've been seeing a lot of that with more natural appearance and more natural methods, and everyone's dissolving their filler. So we've had more and more clients coming into our offices trying to mimic that trend. They still want to keep their look up and keep that skin firm and that youthful look, just making sure that they stay more natural appearing. Now, don't get me wrong, we do still have clientele that that's not what they want. They want people to see that they've had something done. Like we do still have that demographic, but it's definitely less than it was when I started in 2016.
Got it. Now, for your practice, the Beauty Boss, what is your vision for your practice?
We started our first location in Cabot, Arkansas in 2021. My actual brick and mortar location, first one. This past fall, November 2024, we opened our second location in North Little Rock, Arkansas. Um, my goal for this brand and my practice is to make sure that women have a place that they feel 100% comfortable in their own skin. We're doing everything we can to make sure that they feel the absolute best about themselves, and also just to give them time for themselves and to reflect and to do something for them, because I think that women, we overextend ourselves on a daily basis between work and kids and getting everyone where they need to go and taking care of house and doing all of the things. So I'm a mom. I'm a mother to a special needs daughter, and I also have a toddler. My daughter is 13, and then I have a 2-year-old little boy. We're very, very busy, and I know that it's very hard, especially with my daughter, to set aside that time and not feel badly about taking that time for myself. So I wanted to create a space where women knew that was completely okay and that's what you're here for. And you have to take care of you before you can take care of others. So I think that's kind of my goal, is to keep that going. I've been very selective about my staff and providers that we have here, and knowing that they know that that's our mission and what we're here to do, and to just make sure that people feel good inside and out.
Got it. Well, sounds like it's a wonderful vision. Now, Kayla, I have one last question for you, but before I ask it, I do want to point people to your website at beautyboss.co. Now, last question I have for you is, what does beauty mean to you?
To me, beauty is feeling like your best self. So again, it's just incorporating that inner wellness and inner health with the outward beauty and whatever that means to you. Beauty does not mean the same thing to every person. I can go in and look at someone and they'll say, do whatever you think I need. And I hate it when that happens, because what I see is almost always not what they see. And I'm not here to pick you apart and to point out every imperfection on your face and to tell you everything that you need to have done, because that is not my job. My job is to ask you what you need, what would make you feel the best about yourself, and then we go from there. So beauty is totally different for every single person, but for me, it's feeling the best that I can feel inside and out.
Well said. Well, there you have it. Kayla sharing her expertise. So, Kayla, where can people contact you and your practice?
We have the two practices. We are very communicative between the practices, and they're less than 30 minutes apart. So we have separate phone numbers for each location, but anybody that answers either phone can get you to the right place for the right service with the right provider. So you can go through our website at beautyboss.co. There are all of our contact information for each location is there. We're very active on social media, so you can get us there as well through our Instagram, Facebook, TikTok, or our phone numbers will be listed on our website.
Awesome. Well, Kayla, thank you for coming on the show. Thank you for sharing your message. And it was wonderful having this conversation with you.
Thank you so much. I appreciate you having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.